In this video, I'm going to talk about the excuses that addicts, alcoholics, people with mental health disorders, and dual diagnosis clients or intended patients will make to not accept help or complete treatment. And what's interesting is this video will be way shorter than the excuses families make to not do an intervention, because the excuses that the substance users will make are obvious and they're easily addressed, and the person knows why they're making them. With the family, they're much more in depth. There's a lot more psychology behind them, and they're a lot harder to overcome because the families don't think that the families think that they're real, and we know they're not. But the excuses addicts and alcoholics and people with mental health and dual disorders will make range from, I can't go to treatment because of my job, all the way to, I hate the 12-step program. And always remember this, to sum this up in simplistic terms, if they're not talking about going to treatment, then anything else they're talking about is an excuse not to advocate for their own care. Because remember, an intervention is about addressing the resistance to treatment and the family dysfunction that keeps them comfortable and or pulls them back from making a decision. Not intentionally, but does pull them back. So the excuses they make are very similar to the excuses families make. It's not a coincidence that the excuses that families make and the excuses that their loved ones make are almost identical. If you go back up to the excuses video, or if you go on the excuses why families don't do an intervention or wait to do an intervention website, and you see those excuses, those are almost identical to the excuses your loved one will make. So my point is that this is the only fatal illness, this is the only medical problem. Some call it a disease. I'm not going to give my opinion on where I stand on that, but for those that think it's a disease, then this will all make sense, is that it is the only fatal illness, disease, or medical problem where the patient fights to stay sick, their family fights to keep them sick, and when given effective evidence-based solutions, they run the other way. And if anybody watched my other videos on the guarantee and what if they say no section, you'll also know that even when I've given those guarantees, they ran even further. So we know the problem is at its core the family dysfunction, and it affects the excuses of their loved one. Because remember this, and it's in our intervention manual, anybody watching this that has hired our service, we say in there blatantly obvious. The main reason why somebody says no in treatment is because they don't think the family is going to follow through with the boundaries that they've outlined at the intervention. That's why if you have a copy of our manual, we have a copy of an emotional appeal letter. I don't put in copies of the consequence letter because what happens is families will go ahead, copy that letter, and then not fulfill, because I'd rather you have weak boundaries than no boundaries at all, or weak boundaries than strong boundaries that you can't adhere to or follow. So the reason your loved one makes excuses to not go to treatment is because A, they're not held accountable, and B, you're enabling them, and C, they don't think that you're gonna follow through. And then there are some just that they're not ready to stop, but at the end of the day, that's on them, your recovery's on you. An intervention is not about learning how to control your loved one, it's about letting go of believing you can.